Well, Catherine Terry died of a heart attack on July 10th, and her family wants to know why it took 30 minutes before paramedics arrived at her apartment. Now, the paramedics chief confirmed that the service was dealing with what they call a Code Zero event, and that was for about 4 hours that evening when the call came through. Now, that means that either one or even zero ambulances were available during these hours across the city's entire fleet of ambulances in the city. Now, we've heard from Paige Sutherland, who's Terry's daughter, and she says this is unacceptable and her mother might still be here if it weren't for those delays. Take a listen.
It makes me feel like there was some incompetence somewhere. Somebody dropped the ball. And I don't think they realize how important these services are in critical situations like that. And it makes me worry that somebody else is going to receive the same news that I did. That's not fair.
Now, CBC News viewed hospital records showing exactly what happened. So we know that at 9:36, Terry phoned for help, and that's when that emergency call came in. And she had a medical alert system bracelet where she was able to press a button through her wristband. But dispatch classified that incident as a fall and not an emergency cardiac incident because she was unable to speak. Now, 14 minutes later, that is when firefighters arrived to the apartment. They found Terry unconscious and started CPR and then upgraded the call. And then it wasn't until 10 p.m. an ambulance actually arrived at her apartment, and 4 minutes later before they entered her home. So the provincial benchmark for emergency calls is 6 minutes. In this particular case, as you can see, things took a lot longer, roughly 30 minutes. So her family saying that someone needs to be held accountable for this.
So our colleagues at our CBC Hamilton Bureau counting up the numbers and finding that there have been more Code Zero incidents in Hamilton up to 8 months of this year, Shauna, than in all of last year. This has been an issue in recent years. Why is it a problem and a growing one?
Well, this has been a massive issue. To bring you back, in 2013, there were 242 Code Zero events. Now, they managed to tackle that issue, and it was down to 44 in 2015. But as you mentioned, we've seen this coming back up with 79 so far this year. Now, paramedics say that they've seen a surge in calls for help, and there was an annual report that was done by the paramedic services, and they say that this is directly attributed to an aging population. Now, seniors account for about 45% of the emergency calls in the city, even though they make up about 16% of the population. But there's also the issue of offloading patients at hospitals, and that's where a city spokesperson says there's also a huge backlog, and that causes a lot of delays and has forced Code Zero events to happen. And that's because in Hamilton, it ranged from 91 to 107 minutes in terms of dropping off a patient and offloading them. That's due to overcrowding in hospitals, but the provincial benchmark is roughly 30 minutes. So they're way over that. The union that represents paramedics also says that EMS workers are pushed to the limit, and unless there are more resources, we are going to see more people dying.